Good afternoon, everyone. We're just going to give it a few minutes because we're trying to connect the expo site to the Zoom site. So we'll just give it a few more minutes and then we'll kick it off. Okay, we're going to go ahead and get started because there are folks in the expo site as well. I think we've got some critical mass between the two sites. So good afternoon, everyone. I'm Esther Shin. I'm president of Urban Strategies, and I'm extremely excited for this session. At least on the USI side, we've been greatly anticipating this because you've got a fabulous group of panelists and our moderator, who are going to put on, what I believe is going to be an extremely informative and timely session. I hope that all of you are safe and well wherever you may be. That these times have been really challenging and tough. And so as we confront this next phase of the COVID-19 pandemic, we're in the wave of the vaccination, and know that your communities are facing a lot of questions as well as your staff. And so really, when we thought about what we wanted to provide in terms of a resource, the vaccination and education around it being really, really critical, and also making certain that any information that we provided was going to be provided in a manner that's culturally competent and really resonates with the communities that you are all serving. I'm going to introduce our moderator, and he is Mr. Eugene Jones. Mr. Jones has a 35-year record of strong leadership experience in public housing operations, new construction, capital construction, resident services, accounting and finance, auditing and maintenance, and the Housing Choice Voucher Program. He currently serves as the president and CEO at the Atlanta Housing Authority, the Southeast region's largest public housing authority, serving more than 25,000 families, seniors, veterans, and those with disabilities. He has served in top leadership roles in 8 major cities in the US and Canada, including Chicago, where he was president and CEO of the nation's second largest housing authority from 2015 to 2019. Prior to Chicago, Mr. Jones served as president and CEO of the Toronto Community Housing Corporation. He also served as Director of Housing Authorities in Detroit and Indianapolis and held key roles in housing agencies in Kansas City and San Francisco. Mr. Jones is a graduate of the University of Albuquerque with an MBA from New Mexico Highland University. He was an audit manager with the U.S. Department of Housing and Urban Development Office of Inspector early in his career and served as a traffic management specialist in the United States Air Force. And hopefully, if you haven't had the opportunity, you should check out his book, Housing Humans, A Vicarious Memorandum, which provides some unique insights that have been drawn from his long career. Mr. Jones, I'm going to hand it over to you, and Mr. Jones will be our special moderator for today. Thank you.
Good afternoon, and thank you for that great introduction. I forgot I did all those things, but it's a pleasure being here. And it's an honor to introduce the panelists. I'm kind of intimidated because most of them are doctors and not, I just didn't get there that way. But the first one I want to introduce you to is Dr. Cara James. She's the president and CEO of Grant Makers in Health, GIH. And prior to joining GIH, she served as the director of Office of Minority Health at the Centers for Medicare and Medicaid Services, CMS, where she provided leadership, vision, and direction to advance the U.S. Department of Health and Human Services and CMS goals related to reducing disparities and achieving health equity for vulnerable populations, including racial and ethnic populations, persons with disabilities, sexual and gender minorities, and persons living in rural communities. Under her guidance, CMS developed its first CMS equity plan to improve quality in Medicare. Its first rural health strategy created an ongoing initiative to help individuals understand their coverage and connect to care, increase the collection and reporting of demographic data, and develop numerous resources to help stakeholders in their efforts to reduce disparities. Before joining CMS, Dr. James served as the Director of Disparities, Policy Project, and Director of the Barbara Jordan Health Policy Scholars Program at the Henry J. Kaiser Family Foundation, where she was responsible for addressing a broad array of health and access to care issues for people of color and other underserved populations, including the potential impact of the Affordable Care Act, analysis and analysis of state-level disparities in health and access to care, and disparities in access to care among individuals living in health professional shortage areas. Prior to joining the foundation, she worked at Harvard University and the Picker Institute. Dr. James is a past member of the National Academies of Sciences, Engineering, and Medicine, Health and Medicine, NASEM, Roundtable of the Promotion of Health Equity, and has served on several NASEM committees. She has published a number of peer-reviewed articles. Dr. James holds a doctorate in health policy and her bachelor's degree in psychology from Harvard University. Welcome, Dr. James.
Thank you.
Our next one, panelists I'd like to introduce is Lois Prevar Dumm, D-U-M-M, is Senior Advisor, Policy Advocacy of Communication and Director, Adult Vaccines at the International Vaccine Access Center, IVAC, Johns Hopkins Bloomberg School of Public Health, JHSPH. She's an expert on equitable vaccination and access across the life course. Her research covers determinants of vaccine policy, decisions, and uptake. She works in undeserved communities and partners with the local faith leaders to guide conversations about trust in government and institutions to co-create solutions that increase trust and acceptance of vaccination and the systems that support them. Currently, she is focused on COVID-19 vaccine rollout in Baltimore City and Maryland in vaccine hesitant populations. Globally, she works with the World Health Organization on partners to advocate for vaccinations and the Immunization Agenda 2030. She joined Johns Hopkins in 2005 and has worked in more than 70 countries, helping to accelerate vaccine access. She holds a Master's of International Business Studies from the University of South Carolina and Executive Certificate in Human-Centered Design and Innovation and Business Communications from the Johns Hopkins Carey School of Business. Welcome, Ms. Dumm.
Thank you so much.
Next one is Dr. Frederick Harris, medical doctor, MD, noted specialist in internal medicine for 32 years, has achieved the highest honors in his profession throughout his illustrious career. From valedictorian of his high school in 1977 to graduating with high honors from Case Western Reserve University to become a distinguished graduate of Case Western Reserve School of Medicine in 1985. He makes no bones about the quality of medicine he practices as second to none. It's both an honor and privilege to have someone place their life in your hands, and I take that remarkable statement of trust very seriously. Dr. Harris formed Frederick D. Harris, MD, Incorporated in 1989. He spent his first 16 years in private practice while maintaining staff privileges at 10 area hospitals. In 2005, he joined the Cleveland Clinic and is currently a section head position in Cleveland Heights, where he continues to set the bar of quality care metrics. He specializes in hypertension, diabetes, hospital medicine, and chronic preventive care. He is a traditional internist, one of the few physicians who still practice both office and hospital medicine, as well as critical care management. His bedside manner is said to be second to none. He is known by his peers as a doctor's doctor, and his trademark is accurate, timely diagnosis, and superlative care par excellence. Dr. Harris is married to his wife of 30 years, Bernice, and they have 7 children, 6 college graduates, and 1 currently in college. He is an assistant professor at the Cleveland Clinic, Lerner School of Medicine, CWRU, and is board certified in internal medicine. He participates annually as speaker in the Cleveland Clinic's Minority Men Health Fair, and as well as the Cleveland Clinic South Point Health Fair. He is a member of the Clients, Patient, and Family Advisory Council. He is also a member of the Cleveland Clinic's Physician Diversity Program. Damn, he's doing a lot. He's a life member of Omega Phi Psi Fraternity, NAACP, SLC. Dr. Harris was awarded the prestigious 2018 Physician of the Year at SCLC ML King Jr. Scholarship Gala and was honored with a Lifetime Achievement at a surprise appreciation dinner in May 2019 by his staff and well-wishing patients. He is current health co-chair of Ohio NAACP, as well as the chair of the Greater Cleveland NAACP. Dr. Harris has authored The Resurgence of COVID-19, Ohio Task Force Guidelines for COVID-19, Fallacies and Inequities in Current Testing Recommendations for COVID-19, Ohio NAACP, COVID-19 Task Force Strategic Plan for Testing and Contract Tracing, COVID-19 Resurge, Black communities disproportionately affected by COVID-19, and the mRNA coronavirus and guidance for COVID-19. Welcome, Dr. Harris.
Welcome. Thank you.
Woo! And lastly, Dr. Griggs is a health and awareness persona of Eric Griggs, MD, a New Orleans-based community medicine and health educator who has dedicated his professional life to raising health and wellness awareness in communities across the United States. Dr. Griggs graduated from the University of Notre Dame in 1992 and Tulane University School of Medicine in 1996. He has always held a special place in his heart for the city of New Orleans. He has been an active health advocate since graduation and has made his life work to educate the community on health and well-being. Doc is an active participant in all of his programs. Doc Griggs is an active participant in several organizations that promote positive change in the community. He is the health awareness chair for 100 Black Men of Metro New Orleans and also serves as the 100 Black Men National Health and Wellness Board. In March 2014, Dr. Eric Griggs was named spokesperson of the American Cancer Society, Greater New Orleans, and is also a member of the Executive Leadership Council. While health and wellness are near and dear to his heart, Dr. Griggs works closely with the youth, as well as Dr. Griggs proudly serves as the Director of Life Services for STEM, NOLA, serves as the Board of Directors for Playworks, Louisiana, Bike Easy, and previously on the Broadmoor Chartered School Board. Dr. Griggs also founded and directed the Broadmoor Basketball Association, a basketball program for at-risk youth. Earlier this year, Dr. Griggs was appointed by the Governor John Bell Edwards to the Louisiana Children's Cabinet Advisory Board and as a spokesperson for the Governor's Louisiana Youth for Excellence program. Dr. Griggs appears weekly on Fox WVUE's Morning Edition as a health educator every Thursday morning at 7:40 a.m. He also broadcasts every Tuesday with a Doc Griggs show on WBOK 12:30 a.m. from 3 to 4. In addition, he makes monthly appearances on Good Morning Show with Oliver Thomas. Dr. Griggs is also a contributing medical writer for Data News Weekly, a local community paper, and Breakthrough Magazine, a local community magazine. Welcome, Dr. Griggs. All right, panelists, let's get into the questions. And I want to start with Dr. James. This is a long question, so I'm going to speak slowly so that we can address this and all four of you can answer or respond to the question. Here's the first question. What are some of the best practices you have seen to build trust in Black and Brown communities that, due to political climate or historical healthcare discrimination and exploitation, may be holding a level of distrust about healthcare related to COVID and or the vaccine? Dr. James.
Well, thank you so much for moderating this. And I want to thank everybody for being part of this panel and the conversation today. I think that, very simply, a couple of ways in which we can work to build trust and communities is really approaching them, one, from a place of humility, understanding that these communities know a lot about themselves and what the problems are and what the solution should be, really engaging them in that discussion, both to identify what the priorities are and how we go about addressing those, and not assuming that we know what's best for them. I think the other thing is that building trust takes time. And so it's hard that we're trying to do this in a pandemic in many places, but it is that constant engagement and reaching out and making sure that we are listening and speaking to people in a way that makes everyone feel empowered to be part of the solution. And I know that my colleagues have much more to add, but given the short amount of time we have, I'm going to leave it there and let them build on that.
Thank you, Dr. James. Dr. Harris, what do you think? You're on mute, Dr. Harris.
Can you hear me now?
Now I can hear you.
Okay, good. I think the combination that we've been rolling out with these virtual town halls, the combination of the Black physicians, the ministers, the local and civic leaders have done well to impart trust to the communities that we serve. The bottom line, we need to answer everybody's questions, and considering the mistrust and abuse that's taken place during the years, I think the trusted voices manifest both in the medicine, and I say as the physician, follow the science.
Thank you, Dr. Harris. Ms. Dunn.
So thank you very much. And the previous panelists answered this question very well, but I think a lot of it comes down to listening and having the respect to bring together the communities to be able to voice their concerns. And when we're talking about vaccination, we're talking about not just that, but the whole experience with healthcare, with the healthcare system, with government. And we need to really recognize the challenges that people have and the experiences that they bring to the table, and engage them in a way that they're part of the solution. That means bringing clinics to where people are. It means enabling them to help, devise strategies to be able to access healthcare and other services, and really having a voice and showing that they're being heard and not just listened to, and then the strategies continue on the way that they were already planned.
Wonderful, thank you. Dr. Griggs?
Yes, so the only thing that can be added, if this were a multiple choice test, the answer would be all of the above. I think it's very well covered. The only thing missing is the we, right? And in the sender message receiver equation, a lot of times in our professions, we tend to think that we're talking to the community and we're lecturing from above. There's an arrow missing from the equation, and it has two arrows on. It's an arrow that's double-sided, and it's the feedback from the community. So when I say acknowledge the we, acknowledging and being very transparent, and that you are a part of the community, and that a lot of things that happen, particularly when it comes to equity, that most notably that was brought to everyone's attention last summer with George Floyd, the racial inequities that exist in this world that was brought to light by the pandemic. So being truly, if you as a physician, having your own hesitancy and fear when it first came out, understanding that this affects us all, just an acknowledgement of that.
That's a good point, Dr. Griggs. I mean, I was in the same boat when they were developing the vaccine. I was thinking about, is it safe? You know, should I take it? When should I take it, and so forth? And here's a good question. And I think it says it all for us in the beginning. As a healthcare practitioner, describe your feelings on your duty to take the vaccine. Speaking from person, what were your initial thoughts and or reservations? Dr. Griggs.
So I guess you kind of put it by the rim for me, right?
Oh,
So
yes.
in light of the COVID pandemic, not unlike training, March 13th, 2020, I was going on TV once a week for the past 7 years to talk to an audience. As a consequence of the pandemic, I've been on 7 days a week. I've done over 440 segments to about 1 million people a day. And so to build trust, and I very honestly showed my feelings. Earlier on in the pandemic, I was very skeptical. I did not realize messenger RNA technology would be so effective, and I did not know the work that had been done in that arena. So on TV, in front of millions of people, several weeks in a row, Doc, are you going to take it? I would say, you go first. I'm not doing that. And I said, from my household and my community, Black people, we wait for you to go first. And I was Eric, and I was African-American and Black first, even though I'm a doctor, unless the science shows me otherwise. And once I acknowledged that, not only that, I went on TV to take the vaccine, and both of them. And I had an interesting reaction after the first one, because apparently I had been infected and didn't know it. So I already had antibodies. So my initial reaction was apprehension and scared. I would always say, how would you feel if they asked you to jump off the cliff first and test the length of the bungee cord? Because that's what I said, and they quoted it back to me. But then when I came back with the science and I said, you're forgetting the second part, was that unless the science shows otherwise, and I showed that every fabric of every being in me and everyone that's on this panel is grounded in the belief in the science. And once they did that, it seemed that people were less hesitant to, they're showing now that they're becoming less hesitant just by being transparent.
Dr. James, your thoughts?
Yeah, so the good news is I'm not a clinical doctor, so I don't have to really answer this question. I just play 1 and 2 on PhD. No, I mean, but I do think it's relevant for all of us because, regardless of whether we have MD, those of us in the health space, people do come to us for questions and answers about these issues. And I've had a number of conversations. Like Dr. Griggs, I also was a little bit on the skeptical side initially. I'm feeling that I think as many people did, we were speeding through the development of this until you started to dig down and understand that no steps in the development process were skipped, that they did have diverse panels of people who were being participating in the studies and looking at that. So, sometimes we have concerns about whether or not things have been developed that include people who look like us, and they did. So I think, again, as Dr. Griggs said, the science is there, and I have been encouraging all of my family members and signing them up. I'm in the latter category, so it's going to be a minute before I can actually register and get one. But it is one that I'm reaching out and encouraging everybody to do that and to be informed. There are, and I'm sure we'll talk about this a little bit later, there's a lot of misinformation out there, and making sure that people are getting their information from reputable, trusted sources. And if they have questions, as Dr. Harris said, ask those questions and make sure that we're taking the time to answer them so that people feel comfortable about the choices that they're making for themselves and their families.
Thank you. Dr. Harris, same question. You're on mute, Dr. Harris.
All right, can you hear me now? Good.
Now I can hear you.
Okay, thank you. When the vaccine became available, I couldn't wait. I was waiting for my turn. There was a scarcity of the vaccine. Certainly, we studied it first. The kids we studied, we never had, for the most part, 2 vaccines available that had as high efficacy as the 2 that was available come mid-December. The Pfizer had 95% efficacy. They were proven to be safe and effective. Moderna was 94.1% efficacious and very safe with minimum side effects. So I couldn't wait. I'm making rounds in the hospital. I'm going to the office. I'm seeing patients in an intensive care unit, on the floor in the emergency room. I needed that extra protection. I need that coverage. I'm looking at one hand, we had at that time, maybe 400 or 500. Of course, today we're up to 553,000 people that had died. In other words, if you do nothing, it's like a crazy man would expect the same difference. You need to impart something. So I was glad they granted the EUA, emergency use authorization, and I led by example. I took the vaccine after I think the first 2 or 3 weeks. They hadn't called me, so I ended up going, made alternative plans and made sure I got that vaccine, so I would be protected, so I could protect my family as well as the community.
Thank you, thank you. Ms. Dunn?
Yeah, and I think one of the things that we have to recognize is that we're all human, and it's a continuum of knowledge. This vaccine was very new, and I think we have to respect health professionals just as we respect everybody else, that you have to go through a process and you have to be satisfied that this vaccine is going to do no harm. It's understandable that people will have concerns about vaccines. And the important part is that we don't dismiss those concerns, but that we work through those concerns so that we provide knowledge and that we're transparent about what we know as well as what we don't know. So going back to the first question, which was about trust, part of the process is building trust. And I think it's important that, for the health professionals that have a lot of confidence in that they are very clear and in moving forward in their recommendation for other people to get it. But for those that do have concerns or do have needs for more information, they should seek out that information as soon as possible and then move forward, because a confident health professional is going to make confident public.
Thank you, thank you. The Choice Neighborhood Initiative, the grantees, they have to work with the residents every day. And here's another good question that I guess is dear to my heart. It says, Choice Neighborhood Initiatives grantees work with residents from a place of self-determination. What conversations are you having with your family and friends to support them in making informed decisions about taking the vaccine or not? Ms. Dunn.
So
What would you
that's
tell
a
them?
great
What would you
question.
tell them? What would you say? And why would you tell them that they need to take that vaccine or just wait?
Well, first I'd have them examine the risk and the benefit. And one of the things that we've seen with this pandemic in particular is that there is a very, very high degree of risk. And even people that are doing the best they can to take every step possible to protect themselves against disease are getting disease. And it's not just about the short term, it's about the longer term. I also talk to them about the need for protection. It's not just about you as an individual, but it's about the people that you live with, the people that you work with in your community and that you come in contact with. Now, at the end of the day, every single person has to do what is right for them and feels comfortable for them. But I think we all have a responsibility to do whatever we can to protect ourselves and protect others.
Okay. Dr. James, you made a comment about education and so forth. And I guess this is in line with this question about how do you make them make decisions? I guess, Dr. James, what I want to say, how do you get the right information and what is the right information to make that determination and to explain to your loved ones that this is my best recommendation?
Yeah, so I, start with lots of the information that's out on the CDC's website. That is one place where people can go to get information on cdc.gov about COVID, about the vaccines, about the process in which they were developed, about, the impact and the effect that it is having. The other thing is that, it really comes down to personal choice. And so talking to your doctor, if you have questions, that is really your expert who's helping to guide your health, who knows your different risk factors, who can talk about, what the implications are. But I think that there are also, as I said, there are some people out there with, bad actors with misinformation. And unfortunately, we do see people who are being opportunistic at this point in time. So there have been advisories that have been put out about scams, people who are charging false contact tracing, those sorts of things. So Again, I would make sure people are going to the CDC website. They can go to their local health department as well. A lot of them are doing registration, and talk to their health professionals and their usual source of care to get specific questions about their particular needs that they have addressed.
Thank you. Thank you, Dr. James. Dr. Griggs,
Yes, sir.
same question.
So the first thing, one of the tactics, we are dealing with we're a couple of pandemics. One of them is mis and disinformation. The other one, of course, is the virus. You attack them head on. You direct people to those reputable sources, of course, that Dr. James mentioned earlier, the CDC, your local and state sites. And then I take a different approach. I challenge them. Every day. Somebody always got a cousin whose cousin's brother's uncle that works at a lab that knows about a video that was put out by this dude in a white coat that said this bottle came from a bat that you just attacked. So what I tell people is I said, well, can you send it to me? You can give me their phone number and let's have a conversation very publicly. We can go Facebook Live with that person, and they never come back with it. The science is the science. I direct them to the science. You remind them, but then you always let them understand that this is still a personal choice. We've seen it with the trends in our community here with vaccines. Some of the same people that were staunch anti that I'm not getting it, I don't know what it is. Once they started seeing other people get the vaccine and it started to become the cool kid thing to do, are the same ones now that are advocating with me for the vaccine and saying everything about how they want to protect their family, they want to hug their grandmother. So you take a direct approach. I don't believe in elephants in the room. I believe in putting them on the table and we all eat the elephant, and that way we can get that out of the way.
Thank you very much. Dr. Harris,
Yes.
This is going to be dear to your heart.
Yo, no question. I have a direct approach. I've come in a room, I ask the patient, have you gotten your shot? And if they have some hesitancy, I ask them, what are the concerns? What are the fears? And make sure we answer all the questions. And then I give them the real. This vaccine is safe, it's efficacious. It has passed the trials, phase 1, phase 2, phase 3, over 70,000 trial participants, in which 10% were Black or more. I think in the Johnson & Johnson, it may be 13%. And it's proven safe and effective. I've got mine, minimum side effects. As of today, for example, we up to 145 million. So, if you're waiting on somebody to get in line, you're going to be after 145 million. I think that's a pretty good number to get you moving. But more importantly, we're seeing results, significant results, especially in the people who've gotten the most vaccine. The elderly population, for example, looking at some numbers, they were 98% decrease in cases since December the 14th. 98% in that long-term care population, which was the killer. They were actually the ones that hit 40% of the deaths. 40% of the death was in that population. So that their deaths are down 88%. And so forth and so on. So we got not only the initial trials, now we got the trials that are ongoing in terms of everybody that's getting it, and they're pretty much the side effects are minuscule. So it's very effective, very safe. The other alternative, of course, and this is the big one, is COVID. COVID can kill you. COVID can kill you, and even if you get mild COVID, you can have what's considered long hauler symptoms, or syndrome, where you still got, brain fog, chest pain, shortness of breath, and so forth and so on. So it's not a benign disease. So we encourage everybody to get the vaccine and get the vaccine as soon as they can to protect themselves and their family, as well as the community.
Thank you, Dr. Harris. So here's a good question that I would present to the whole panelists, because I don't have the answer to it. I know one of the four of you have it. If persons do not have access to health insurance and or primary care doctor, are they still eligible for the vaccine? And if so, how can the Choice Neighborhood Initiative grantee support accessibility? To anyone, the panelists.
Yeah, I can start. So the vaccine is free. There is no one who should be charged for the vaccine. There are cases where people are registering to get the vaccine. They may be asked for insurance information, but they should not be charged. So that is one, they sometimes use that information if for those who do have insurance for administrative purposes, but the vaccine is free. So if you do not have insurance, and that is something in our community that's still an issue, you should not be charged. You can still get the vaccine. So please register.
And if I could also add to that, I think one of the important things is to go to places, often for people, is to go to places that they trust. And there's plenty of places that people can be vaccinated right now. Many states are now having equity issues, where equity initiatives, where you can get your vaccination at a church, you can get it at a community center or other places where you know that you are going to be able to go in there and be able to get the vaccine. You will, as Dr. James said, not be charged at all. In some of the communities, they are concerned about documentation, and that has become a major issue. And it's very clear that they should not be asking for any other documentation other than proof of appointment and proof of identity. So that means that you can have identity from your home country or any other place. And that's something that needs to be clearly articulated. And one place that community organizations can really help and be giving people confidence that they can go and that they can get the vaccines and they won't be asked for documentation that they can't provide.
Thank you. Dr. Griggs, Dr. Harris?
Yeah, I want to address, before Dr. Harris is going to bring it home, I know he is. I want to address this. The call to action part of the question. What can the CNI grantees do to support it? Get involved, jump in, call your local government, call your state government. And there are committees. We have a vaccine strategy committee, of which I think I'm on every level possible. And I encourage members of my community, especially the naysayers that have changed their minds, to get on, to actively be involved and advocate for the allocation of the funds to go where it's needed, specifically for transportation issues and accessibility issues. If you're not sitting on the table, you're on the menu. And part of my realm of community medicine is people, policy, and practice. And a lot of times we're left out because we're not in the policy rooms. And I don't mean those of us with degrees and titles like we are here. Those allow us in the room, but the voices of the people need to be encouraged to be in those rooms so the funds can be allocated properly. Now, I know Dr. Harris is about to bring it home. I know it.
Yeah, listen to him. Thank you. There's no out-of-pocket costs for COVID. Not only the vaccine is free, there may be what's called a administration fee, but it's waived. If you don't have it, don't worry about it. So the vaccination is 100% free. The government will take care of that. Not only that, the virtual care, it relates to COVID, is free. Co-pays are waived, as well as deductibles in relationship to COVID related issues. So don't be hesitant when it comes to seeking care for COVID, both the symptoms as well as getting your shots.
Thank you, Dr. Harris. Very, very informative. So here's a question, and I'm not too savvy on this, but here goes. Can you talk about the mRNA technology, and can the mRNA trigger autoimmune responses?
No, it can't trigger any autoimmune responses. Who made that up is what I would tell a person who would ask that. The mRNA technology goes back to 1990s. So it's not something that happened overnight. The two vaccines that we used, they went through oncologic as well as MERS and SIRS and so forth. So this is not something that happened overnight. We always say we stand on the shoulders of the ones that came before us. The same thing with this technology. And so they were able to stand up on that sort of bridge and make sure that it happened. But the bottom line is that mRNA technology is not new.
So can I add to it?
No, you can't, Dr. Griggs. No, I'm just kidding. Go ahead, Dr. Griggs.
So if you want to think about mRNA, I like to think about it. I grew up in a very small house with my grandmother and grandfather, and on Sundays we would have Sunday dinner. My grandmother was in the kitchen at the stove. And in the morning, she would have me go in while my dad was reading the paper. I would go in, find out what he wanted for dinner. So I was basically messenger RNA. I would go in the front room, I'd get what he wanted. He wanted pot roast, green beans, and potatoes. It was just a staple. I would get the message from him. I'd run in the kitchen and tell grandma that dad wants pot roast, green beans, and potatoes. Well, that's exactly what this is. I was messenger RNA, then I would go on about my business and go play. What's being injected is the genetic code for the spikes. If people have seen that, when I say COVID, you see a white golf ball with red spikes on it. Well, what happened is we took the code in January when they released the code, genetic code for the virus. They were able to pull out the code for those spikes. And that's called an antigen, or the protein that elicited an antibody response, or the soldiers in our bodies that fight. Well, what happens is we take that code, little bad Eric comes from the front room, runs to the kitchen, which is inside the cell called the ribosome, where the proteins are made. We take that message, we go in there, we give that recipe to grandma, and the ribosome cooks up the recipe for the spikes, and those spikes create an antibody response. And that antibody response is what it remembers. Anything that comes in the body that has those spikes, our soldiers, our antibodies fight it off. So that's messenger RNA. If you can think of your bad self when you were a little kid, taking a message from granddaddy to grandma and going about yourself and playing, that addresses two things. One, it shows that they're not injecting the actual virus into you. And two, it shows you that the messenger RNA goes on about its business, and you become a spike factory to protect yourself. It's safe, and it's something that's been around, like Dr. Harris said, since the 90s.
Yeah, and it's not a live
Good
virus.
response.
On that. Yes, not a live. Mm-hmm.
Great response.
Mm-hmm.
Dr. James, here's a good question. It's going to take some thought process here, Dr. James. How should community organizations move forward safely in a post-COVID space? How long should we wait after full vaccination to resume in-person events/meetings?
I know it's a great question, and I know we are all anxious to get out and get back to our activities of life. I'm going to say that, again, this is one where people need to follow the guidance of the CDC and their local health department and those rules. There's not a hard and fast, X days after you've gotten full immunity, everybody can go back to life as normal. I think that we need to, as we're seeing, there's still, time where we need people vaccinated, the mask mandates, we're seeing some spikes in variants and other things. And I think that we just need to follow the guidance of the CDC and our local health departments and state departments, state health departments around what that looks like. But there are a lot of people who are thinking about it, particularly on the business side, what that means for how do we safely open up our businesses again, making sure our schools are there. But again, I lead with following our public health experts for when that should happen.
Ms. Dunn, same question.
I think that's absolutely right. And one of the things that we have to remember is that every community is different, and you're going to have different levels of compliance with the recommendations, different ability to social distance. It is a concern. People want to get back to normal as soon as possible, but I think we have to recognize that at least for the short term or the immediate term, there is no new normal, and that may be something that we need to accept. In the meantime, what we need to continue to do is continue to have good testing, continue to ensure compliance, and continue to vaccinate as much as possible. And we'll have to recognize that maybe we'll have to do the things that we did before in a different way and come together in smaller groups. There are places already where you can gather safely. And I think we're learning more every single day about what's even possible. I just read this morning, I think it was, that in Barcelona in Spain, that they were bringing people together in a concert situation where they had all been pre-tested. And that type of thing is important because it gives people hope that you can come together, but it's not just that they're bringing them together and saying, well, there wasn't a problem, so it works, but they're going through a a protocol where they're testing people and seeing what happens and seeing what is reasonable and what isn't reasonable. So what I would advise is that we let the experts guide us as to what we can do and what we can't do.
Thank you. Dr. Harris?
Yeah, until we achieve what's called herd immunity, we still got to maintain our public health measures: wash, mask, and distance. I've gotten my shot, and you can, they say if in your home everybody has gotten a shot, you can take off the mask. Also, the grandparents are now moving in and seeing their grandkids that they haven't seen in a while. Once they got their vaccination, that's okay too. The only thing that they look down on for at least the moment now is air travel and that type of a thing. They don't consider that necessarily safe. But I think we can start letting your hair down a little bit. But until we achieve what's called herd immunity, meaning 70 to 80% of us has either had the disease or have adequate antibodies or have had the vaccine, we're not sure exactly what this post-COVID space would look like. Now, some have jumped the gun, like cruises, for example, and started vaccination immunity passes, so to speak, or passports. In other words, once you've gotten your shot and you got your card, they're going to open up places where it's exclusive for people who've gotten their shot. In fact, it's going to become mandatory in some businesses, including medicine. In fact, as you know, flu shots are already mandatory in the healthcare industry. And COVID is much more infectious and more deadly than that. So all that's coming.
Thank you. Dr. Griggs?
Yeah, so one of the things that we have to remember is that this is not a helicopter ride. A helicopter ride goes like this and it can sit down. This is a very turbulent, bumpy airplane ride. And we're gonna have to go back up and go back down, just like the numbers. If we don't continue to follow the advice of the public health experts and the advice of the CDC, we have to continue masking, we have to continue social distancing, washing hands, of course, we have to get vaccinated. But there's one thing that people are leaving out, because there's an elephant in the room, and of course, I'm gonna throw it on the table. It's called variants. We're seeing spikes all over the world now. We're seeing Italy and France have to close down. Michigan is undergoing a spike right now. There's a second spikes going on in other countries. One, there's a couple of factors. We can't get tired. COVID fatigue is prevalent everywhere. I live in New Orleans. The French Quarter is full, and we miss Mardi Gras. People can't wait to be outside. Right. It's not over. It's not that helicopter ride. But the other part is, in order for us to properly do this, we have to get our vaccinations, but we have to get tested. The testing is down, and the vaccines are up right now. We can't survey and see what variants are most predominant, because one common theme amongst all the variants that are out there right now is they all seem to be more infectious. And because they're more infectious, that means more people can get, even if they're not even more deadly than the original, more people will be affected, and the potential to jam up the hospital system, which leads to more deaths from COVID and other causes, is there. So we have to be diligent about being tested. We have to get vaccinated and understand that this is not going to be over. There's no light switch. We're going to be wearing masks for a while and practicing responsible social distancing.
Yeah, and then, just walking down the street, going to organizations. I mean, some will have a mask on, some won't have a mask on. Some people who've gotten the vaccination, COVID twice, they feel like they're invincible, that they can't get it again. Then they let the guard down. I think a lot of people, I'm not saying everyone, a lot of people are taking it for granted that if you get the shots, you're good. I mean, you get next to somebody and they have it, you're not going to get it again. So it's a worrisome event still. And I don't think everyone understands that we're going to be wearing those masks for a long, long time until we find something that's just going to knock it out, which I don't see in the foreseeable future. But that's a scientific determination. Question, Dr. Griggs, through a public health equity lens, what has COVID-19 taught us as a society? What has it taught us?
What's interesting there, COVID-19 pulled the Band-Aid off of the wound that had been festering for a long time. We haven't had, in the history of this country, there hasn't been health equity. Equity means equal access to care, and people like to make notable the Tuskegee experiment, of which there was a myth that they were injected with syphilis. Well, syphilis doesn't work that way. The way what actually happened is they were denied care, which was a travesty. There was a consensus that we're not going to treat them and we're going to study them. And then the Henrietta Lacks, the whole nine. What it's taught us is that there's no equity, not just in healthcare, but in our society. Not everyone has the same access to a bus, a car, a job, even equal care sometimes on the other side of the exam room in the office. So COVID-19 has just pulled back the curtain on everything and shown us very publicly that we need to fix the system by giving, even with the vaccines. If you look at the numbers right now, minorities, Black and brown people and minorities are the numbers are it's almost 2-to-1 in some communities. Right. So it's really revealed what we've known for a long time and now we have the opportunity to address it.
Ms. Dunn, same question.
So the one thing that I think is really important is that building equity needs to be very deliberate, and that it takes a lot of work. Just saying that you want to target disadvantaged populations isn't enough. We really do need to work with communities to make sure that we're putting them at the center and reaching out to provide things like not just the products, but things like transportation, things like better communication, treating with respect, and a lot of things that are missing from the healthcare system. They're more general issues, but we need to take a very holistic view to equity and not just treat the particular disease, but treat the person and really respect the person and start addressing some of those issues.
Wonderful, great. Dr. Harris, same question.
Yeah, as you said, the coronavirus pandemic has once again shed light on longstanding health and racial inequities. Often quoted, when white America catches a cold, Black America gets pneumonia. So what we mean by that is these health inequities are longstanding, and systemic racism factors are the basis for many of these disparities. Black communities, we have underlying conditions. When we get COVID, it affects us much differently. We have a higher rate. I think underlying conditions give you 12 times the cost of getting or dying from COVID. There is a 2 to 3 times the death rate and increased hospitalization at least 4 times. So the disparities are pretty obvious. And what happens is, for the most part, people come into the equation with uncontrolled blood pressure, uncontrolled diabetes, and uncontrolled other medical conditions and things that they had been avoiding and so forth and so on. And when they get the COVID on top of that, they go in the hospital, the sugar's out of control, the pressure's out of control, they have strokes and clots and so forth and so on. So what it goes back down to is we need to have a primary care physician. High blood pressure, as you know, accounts for mainly heart disease more than anything else. And that accounts for 1 million deaths a year, even in spite or before COVID. So very important that we get a PCP, because that's still our major problem is that we don't have access to the healthcare that others do.
Good point. Dr. James?
Thank you. I could spend all day talking about this one, but I won't, since we only have a little bit of time. I think that, one of the things, I'll lay out a couple of things that we have learned through this from the health equity lens. One is that we have racial and ethnic disparities in every facet of our life. COVID has affected every facet, and in every one of those you see disparities, whether it be the disease in terms of who gets it, who's hospitalized, who dies, whether it be education, who's participating in virtual education, whether it be food insecurity, whether it be housing insecurity, whether it be sort of economic and recovery. Even if you look at those small businesses who initially were not getting the paycheck protection program, that we're participating in that. In every facet of our life, we have inequities that need to be addressed. We've also seen that people are now talking about this, and it's great. We're having a lot more conversation than I've ever seen in my career around health equity. We're not all talking about the same thing. Health equity is giving people the opportunity to achieve their highest level of health. It means giving people what they need. So if you look at that example, and Dr. Harris was talking about individuals who need transportation or who have food insecurity, giving them the tools and the resources that they need to be able to get what they need to achieve. Giving everyone the same thing. You think about, those bicycles, you see people with different needs. Giving somebody with a disability a bicycle that looks just like a bicycle for me is not going to give them what they need to be able to get from point A to point B. So we need to give people what they need. We've also seen that our patchwork system of healthcare fosters the disparities in some cases that we see and only leads to partial solutions, that we need to have a more systematic approach. We've seen that leadership matters at every level, federal, state, local, and that communities that are lacking that leadership are also the ones that are struggling and falling behind. And that our state and local governments are critical to our solutions, and yet often they also lack some of the resources that they need to be able to address these issues, and particularly to focus on a lot of the vulnerable communities, whether it be translation of materials, making sure that testing sites are in communities at high risk or access and other needs. And then the last two things I will just say is that we cannot underestimate the need for that clear, accurate information that we have seen come over and over again, because as Dr. Griggs mentioned, we're fighting two pandemics, one on misinformation and one on the pandemic. And the last thing is that despite the awareness that we now have around the health equity issues, we still remain incredibly divided. And that these are, as Lois mentioned, issues that are going to take a long time for us to fix. These are things that arose over several hundred years, and they're not things we're going to fix in a 30, 60, 90-day plan, but we need sustained attention and effort on that. And we need to come together to be able to address these so that we're not flipping the switch back to where we were when there's a change in leadership in the country.
Wonderful. I know we got to close, but I want to make a statement from the bottom of my heart. I think this panel should have been on a national level, because you guys are the practitioners. You see it, you do it, you talk about it, you communicate it, you work in the communities. This is what the whole nation needs to see from you as a practitioner, because they believe you guys. And I've got a different appreciation of what you guys have been doing every day just on this short, hour conversation. So I take my hats off to you, because you guys are very concise, very precise, and you're knowledgeable in what you're doing, and that breeds well with me. I just want to thank Dr. James, Dr. Griggs, Dr. Harris, and Ms. Dunn for being on this panel. I enjoy being a moderator because I learned so much, and I do appreciate what you guys have done and your time that you've given to this panel, and it's just so informative. And I just want to thank you from the bottom of my heart. Thank you very much.
We thank all of you. Thank you so much to the moderator and our panelists. This was an amazing session. It has been recorded, so it will be put on the Communities of Choice website, so that our grantee partners can have access, and your communities will be able to watch the video if your partners didn't have the opportunity to participate today. Thank you all so very much for participating. This information is invaluable. Please, everyone, stay safe and be well.
Thank you.
Thank you. Bye.